Dr. Sam Hazledine here for another episode of the Well Doctor series. When I got the opportunity to talk to Dr. Sarah Arachchi in preparation for this podcast, I was excited. Sarah has just published a book called Brown Female Doctor, and my assumption was that this book was about sexism and racism in medicine, and when we spoke to prepare for this, I launched into it. But I was wrong. The title is Brown, full stop, Female, full stop, Doctor, full stop. It's a description of Dr. Arachchi as a person. It's not a statement. Like many, I judged the book by its cover with my own biases and preconceptions. So today, we're going to discuss some of these topics and I'll be learning along with you. This is a conversation about awareness, I think, as much as anything else, because I believe the light of awareness is the beginning of breaking down some of these biases. So welcome, Dr. Sarah Arachchi.
How are you, Sam? Nice to be here today with you.
Great to be here with you too, and congratulations on the launch of your book.
Yeah, thank you. Very excited for this to be on the bookshelves. It's been about 2 years in the process of getting this book out into the world.
Yeah, and how's it being received? I'm seeing there's lots of media and things around it with you.
Yeah, so it's been very well received so far. I've had opportunities to be interviewed in radio and also TV, and it's been recently reviewed in the Age, Sydney Morning Herald, as one of the books to read in June. So that was exciting just over the weekend.
Excellent, awesome. And it's your first book, is it?
It's my first book, that's correct.
Well, congratulations. What a start.
Yeah. It's definitely look, it's a different process now that I'm a doctor author,
Sure.
but nice thing to add to the list of things that we can do outside of medicine.
Absolutely. Look, when we were preparing for this podcast, you shared with me, and I think this is important, a useful way to sort of start this conversation. You shared with me the importance of how you introduce yourself to patients. And it's related to the book as well. So can you share how you do that and why that's so important?
So I introduced myself, Sam, as Dr. Sarah Arachchi, Paediatrician. And I think it's important, first of all, for me to distinguish that patient-doctor relationship. And I think it establishes from the beginning that I'm the doctor. In the past, and, it still happens even when I do introduce myself as Dr. Sarah Arachchi, I'm not necessarily seen as the doctor. And I think for me, it's been a really good way to get that message across to patients. But I think as professionals, we should introduce ourselves with our full name because we are doctors, So it's fine if my kid patients call me Dr. Sarah, or later in the conversation, I refer to myself as Sarah. When I ring up a patient, I might say, "Hi, it's Sarah, paediatrician." So it's not formal all the time. But I think for me anyway, it's important to use my title.
I remember when we were preparing and you shared that, and I was reflecting back to, when I was working as an emergency doctor, and I'd walk into the room and I'd introduce myself with, "Hi, I'm Sam." And it didn't occur to me that I might be mistaken for anything other than a doctor. And for me, just that sort of reflection highlighted the different environment that the exact same environment presents for me, to some extent as a white male doctor and you as a brown female doctor. It sort of got me thinking about how much more you have to think about. And, as you pointed out, people judge books by their covers and as we're going to explore, I think this is generally the wrong approach, isn't it?
I think so. And I actually learnt this when we were over in America, when we went over to the Mayo Clinic in 2020, 2021, where doctors over there are referred to as Dr. whatever their last name is. And when I came back from America, that's when I started to use that in my practice. And I think I think it's just an important concept to recognise that we are we're medical professionals within hospital systems or in your clinic, and it really distinguishes that doctor-patient relationship that needs to be established anyway. But you're not their friend, Sam. You're not their friend. You're their doctor. There's a difference. Yeah.
Yeah, absolutely. Well, let's get on to the book. You know, why did you write this book?
Well, I wanted to increase the visibility of people like me. So, specifically, like even on the cover, I wanted to explore the different, my different identities, where that intersection of being brown, female, and a doctor basically is something that I experience every single day. Secondly, I wrote this book because I feel that it would resonate with many Australians who have a second, cultural background. I think in Australia, about roughly half of people's parents are born overseas,
Wow.
and so within the book, I explore that concept of that tug of war between, your cultural background and then being Australian as well. And then I also wanted to highlight some of the experiences I've had with patients, which I think would help doctors in training, as well as my own stories of burnout and, becoming a mother and going through pregnancy and things like that, which again, I felt would help some of my female colleagues who may go through similar experiences. So it was really a book where I wanted to share my experiences in the hope that other people wouldn't feel so alone when they're going through similar experiences.
Did you feel very alone going through those experiences, in your training and your journey through medicine? Do you feel like it's something that needs to be spoken about more?
Look, I think, Sam, because I'm someone who is very vocal, so I always have surrounded myself with other people,
Right.
friends, and we'd catch up for coffee and talk about things that bothered us. And so for me, I always had some kind of support network. During my when I joined Medical Mums, for example, which is like a Facebook group in Australia and New Zealand, that was just before I had my first son. And that was a very supportive online community where some of the things that I experienced, I realized I was not the only one who felt like that. The sleep deprivation, being a new mum, and then, having to go back to work and all the guilt that you feel when you're having to go back to work, that it was a normal process, that other people also felt similar to me. So, whilst I'm not sure I would necessarily say that I felt alone, but I feel like a lot of people do struggle in silence. And it's this concept in medicine where the culture is that you just keep going.
Mm, mm. And so, I mean, by making it a conversation, by writing a book about it, you hope to sort of keep that enliven that conversation. I imagine make people feel like they aren't doing it by themselves.
Yeah, correct. Yeah. So, and I think like a lot of people who have started reading the book have been messaging me directly and saying how much a lot of the stories they can resonate. It resonates with them.
Mm,
And some of them have said that there's parts that have made them cry because I think really it resonated quite deeply with some things that they've experienced
mm,
themselves. And so I think, it's only by having these conversations, Sam, that we can move forward. Other
mm.
people can share their stories or feel like they can bring it up as
Yeah.
well. So I think it's important because it helps to start to build more support systems for people who may not have them in place.
Yeah, absolutely. In the book, you talk about the sort of the two cultures, that you've grown up with, and you also talk about, people wanting to put you in a box, and the challenges that come with that. Can you talk a bit more to that point? Because I found that part really interesting, and I guess I'm interested in how you sort of deal with that and how you encourage people to deal with that.
So, for example, as well, Sam, like even with this book, right? So I specifically wrote brown female doctor. Like as you said, it was my identity, different
Mm,
aspects. People automatically assume it's a book about racism and sexism, which it's not
mm,
at all. And I'm finding also that a lot of people assume it's for brown female doctors, which it's again
right.
not.
Yeah. Yeah.
And so a lot of, so I think that's again a bias, isn't it? Like
It
people are
is.
medical doctors could read this book. Any doctor you don't have to be a woman, you don't have to be, you know, brown, you don't have to be of another culture, because I don't just talk about my experiences of, there are some experiences of racism, yes, that I have described in there, but
Yeah.
it's not just about that. And so I think for me, people always look at me and then they wonder where I'm from, or they ask me where my surname's from. And yes, I understand that that could be from a place of curiosity, Sam. But always I felt like the need to explain myself, not because I'm not confident, it's because I always get asked these questions. Like, how many times have I been asked, where are you from? Hundreds of times in my whole life. And that's not just in Australia. When I go to Sri Lanka, the same thing happened.
Right. And then, reading the book, you talk about that time there's in Gippsland, and it's not just where are you from, it's like, where are you really from?
Correct. Yeah, exactly. And it's like, well, that comes from someone else's curiosity, right? So if you and I are having a conversation and then you're like, oh, I'm from New Zealand and I love, whatever it is, the food. And then I then let you know about what my cultural background is. That's completely different. And I get asked even on the street, like in the shops, when I'm just randomly walking past. It's a constant thing. Cafes, wherever I go, it's a constant theme. And after a while, you just kind of get a little bit over that,
Right.
specific question.
Yeah.
And I know that other similar people of color often do get asked these types of questions all the time. Um, and look, ultimately, like, we are a multicultural society. I understand that, and I think it's important. And I love my culture, so it's not that I'm ashamed of being Sri Lankan background or anything like that. But I think it's, as you said, people try and put you into a box, and that comes just from biases, societal biases. And again, in the hospital environment, you see that when patients ask you, where's the doctor, even when you've told them that you're the doctor.
Yeah, absolutely. To me, I think, because I was reflecting on this after we prepared for this, and something I was reflecting on was the importance of that this is not necessarily yours to solve. To me, it was like, okay, this is a reminder for me to have the awareness of, because I think biases, the light of awareness is what sort of, can break those things down. So when I find myself, since our conversation, about to ask someone, where are you from? I catch myself and I go, hang on a second. Is this the right question? I might be being curious, but is this the best question to actually form a connection with this person? Because it's on me as the person asking, as opposed to them to re-educate me, I think.
Correct. And if you're curious about someone's background, you can simply ask them, what's your cultural background? That's all.
Mm,
It's pretty easy. Like, it's not that difficult.
mm,
And I think, like, when you've gone through, and I think that's why I write this story from birth all the way through. And when you've gone through that as a young child, when people have told you to go back to your own country in the schoolyard
mm.
during the Pauline Hanson era, which was quite traumatizing
No
for
doubt.
a lot of kids, and a lot of people talk about this, where we would get called names and, like, told that you don't belong. So when you've had that growing up, and then it's even though it's a little chip on your shoulder, it's there,
Yes.
and you remember it, and it's just
Yes.
like this constant, like, stop asking me that question. I've lived in this country for how many years now?
Mm. Yeah.
I'm Australian,
Yeah.
so it's just, look, it's tricky. And I think, for me anyway, like, my cultural background, it helps me. So it helps me with patients of other ethnicities. I feel like I bring a different difference to the room, where a lot of people open up to me about things that they may not open up to someone who doesn't look like me. So it has
Mm.
its advantages as well.
Sure.
And so it does help to bridge those cross-cultural barriers at times for me. I've definitely found that. But as you said, yeah, we just have to raise that awareness.
Mm. And then everyone take responsibility. I think this leads well into medicine and the culture of medicine, because I found it interesting. Um, yeah, and disappointing and not surprising. That when we were preparing for this, you know, it wasn't until you really got into the hospital system that you started to experience sexism,
Correct. Yep.
which
Yep.
is, you know, which is just awful. You
Mm.
know, tell me about how that sort
Mm.
of came about in the hospital system, and I guess from a perspective of what do we need to be aware of, like what are
Mm.
how can people help be part of that, changing that, because I don't think many
Yes.
people want. That's the thing I think in healthcare. I don't think most people want to be sexist. Most people don't want to be racist. There's obviously going to be some, but it's like, what are we doing without even being aware that we're doing it?
Mm. So for me, Sam, like going through high school, I went to a girls' school, and that had its advantages
Mm,
and disadvantages, but it had its advantages in the sense that I was always encouraged that I could be anything, be anyone. And it really did foster that strong sense of feminism. Went into
mm,
medical school, again, my cohort, there was more women than men in the cohort. So about
right.
roughly 60%, if I had to make a guess, in my medical cohort at Monash. And then it was only when I started going into the hospital system, as you said, like when I was an intern and so forth, where I started to meet these barriers, where I was suddenly reduced to being a woman. And when I say reduced to being a woman, it was in comparison to a man. And it was often where, I may not have had similar opportunities because I was a woman.
Mm,
And this was often from older men, male consultants that would not necessarily give me the same role as the male medical student. I was asked to make the beds one time on a rotation whilst my male colleague was given the patients.
mm,
And, I've referenced things like being called shorty, which was, by a male consultant in the hospital system. So
yeah.
again, these are not nicknames that I shared, or I never had these nicknames. Someone just gave me a nickname just because, yes, I am short.
Right.
But look, I think women and men, like where we should be treated equally.
Mm-hmm.
We all have strengths, and I think you just have it just has to stop. Like I don't know how we're going to stop it, Sam, but I think by education
Mm-hmm.
um, and sharing these types of stories of what women often experience. I mean, it's not just my story. There's so many, reports out there. Other people have also written books about their
Mm,
experience of sexism in the
mm,
medical field. So we know it's there. We know it exists. I think we need to have more supportive, probably more mentorships, if I could say anything,
mm-hmm.
Sam, from other women and male mentors,
Mm-hmm.
um, and not putting women in a box as well. So look, I went through medical school 20 years ago, but I would say that when I speak to some of my interns, they still experience discrimination because they are female, and I've heard stories from them
Mm,
where they've explained that to me.
mm.
So it's a struggle. It's a struggle, and even as a consultant, there's vertical segregation in leadership positions. It's getting better. It's definitely heading in the right
Yeah,
direction.
so you are seeing it improving.
Yeah, definitely. I think it's improving. But whilst you put women on boards, their voices need to be also heard.
Right.
It's not just about representation, it's about having that equality and inclusion of women's voices. So
Mm,
it's not enough to have a certain percentage of women on a board. You need to let them talk and
mm,
don't talk over them. These
mm,
are the things that I often hear from women in high leadership positions, that when they talk, people talk over them.
mm.
So give them the space that they deserve.
Yeah, because and to me that was something when we were preparing for this, and you'd said my question was, what could the sort of your classic male doctor do, and you said give them the room, give them the space, give
Mm,
people the space to be heard, and I thought that's again it's about awareness, isn't it? Because I mean, often, the stereotypically, often guys just sort of are more sort of, they jump in, they talk over people, and actually having the awareness just to pause and go, I actually
mm,
have to manage myself, because I've heard some people, saying, well, I shouldn't have to manage myself, other people should. But actually, it's like, actually, we all play a role in managing both our strengths and our weaknesses and being aware so that, in any situation, we're a better member of our board, for example, because we sit back, we pause, we make sure everyone gets a chance to speak.
Yes, correct. And look, I've had beautiful male colleagues, consultants who have been extremely supportive of me throughout my career. So it's not, I think it's not specifically like I think we can't generalize as well. So
Agreed.
some specialties perhaps need, a bit more of a push than others. And when you look at female dominated specialties, pediatrics is one of them. Around 60% of females in the last medical workforce statistics report from 2024. So I was lucky that I went into pediatrics and there was a lot more women. So it was a lot easier for me when I went through pediatrics because I was given the space to speak,
Mm,
But I think society needs to change as well their perceptions of what a doctor should look like.
mm.
Hence why, they see this, you can have brown female doctors like me.
You can indeed. I mean, you're certainly getting that message out. But you're right. It's a multi-pronged attack, if you will. But it's a multi-pronged approach, isn't it? It's like in the conversations and giving encouragement to, say, anyone who feels marginalised. But it's also educating patients, and it's and just to a big greater extent, because it's harder to control the perceptions of patients. But I think where there is a responsibility is on us as healthcare professionals and colleagues. Like, we have a real responsibility to make sure that our workforce is more diverse, is more inclusive, is more reflective of the patients, and is represented, and is equally represented as well. It's not just someone talking and over. It's actually just making real conscious effort, isn't it?
Mm, exactly. Yeah. So I think, yeah, as you said, give them the room, let them speak. We should just let each other speak. Like we're all equal,
Mm,
and we shouldn't we shouldn't put anyone down or like let them not not help them. Like even in when you look at spaces, for example,
yeah.
how can we move forward? Build hospitals with medical spaces for women. So when they come back from maternity leave and they need space to, if they choose to breastfeed and they need to
Hmm.
pump milk, have a space for them in the medical, in the staff room, so that they can do that.
Mm,
We're not making the spaces for women even physically.
mm, mm. In New Zealand, we have the Treaty of Waitangi, Te Rito Waitangi, and that was signed a long time ago, and it talks about equality of outcome. And I think, to me, that's the way we should think about equality. It's a quality of outcome, not necessarily a quality of input. For example,
Mm.
particular spaces for women doctors to breastfeed, those sort of things. You got to focus on the end result, not the input, don't you? The end result is equal ability to practice and treat our patients, isn't it?
Absolutely, Sam. And women, like when I came back from finishing off maternity leave, it was a real struggle. Like I had to figure out, how am I going to find like a job to continue my training? Is it going to meet the training requirements? Like it was really, really hard. And then going back to work, I had to go and pump in the patient area. Luckily, I was in a neonatal hospital at the time, and
Right. So it was
I
one.
was yeah, so luckily, but still, like I was
Yeah.
still having to pump in like with curtains closed, but it's where parents would go and,
Mm,
breastfeed. And then I had to go and find a place in the staff room
mm.
to put the breast milk. And
Right.
it's like, it's a bit not embarrassing, but like, it's not necessarily ideal, is
It's not
it?
very welcoming, is it?
No, not as look, I ended up developing mastitis, and then in the end, I had to give up breastfeeding, which was,
Right.
for me, something I would have liked to have continued. But I'm not the only one who shares that story, Sam. And then similarly, going through pregnancy, it is more challenging. Look, it's not an illness, but it's definitely more challenging for women. There's complications that women have, especially
Hmm.
doctors. And I think we need to recognise that and support women who are going through that with supports when they're pregnant, so that they have, you know, the ability to reach out to someone if they're having difficulty, and just let them know in it, like have someone there in advance, not when it happens and when they're looking for who do I contact if something goes wrong, like how can I amend the roster if it's becoming hard for me to continue my work because it's affecting the pregnancy, for example. Like there are all sorts of things that we have to juggle as women, but not a lot of people are thinking about it. Like I had to go and hide in a toilet when there was x-ray machines coming because I didn't want people, it was early in the early pregnancy, because I didn't want people to know I was pregnant. And like,
Right.
it's just, you know, like just there's small things that we can do to make it, you know, the spaces better for women.
Yeah, yeah. And again, I just sort of come back to it's everyone's responsibility. It shouldn't be women fighting for themselves. It should be all of us fighting for a better healthcare system that is more inclusive and more diverse and, you know, more reflective of our patients.
Yeah, exactly. And look, who knows where you start? Like, perhaps hospital administration needs to make some changes.
I mean, you know, we're talking to an audience of doctors here, so you know, I guess anyone listening, you know, where would if someone wants to be more of a part of the solution, like what encouragement would you give them?
Sorry, one second. This thing is making noise. Sorry, that was just the robot rock. Sorry, can you can you go through that again? It just
That's all
started
right.
talking.
The question I had was anyone listening, because we're talking to an audience of doctors.
Yep.
You know, anyone who wants to be more of a part of it. Well, I'll ask you as well about, you know, advice for someone who feels marginalised. But this question is more about, you know, if someone wants to be more of a positive part of the solution, like what advice would you give them?
Go and talk to other women. If you're a man and you want to know, just ask your female colleagues what it's like, what challenges they've had. You know, it's very easy. Sit down with them, have a coffee, listen to what they have to say, and it'll change. Perhaps it'll help them to understand, you know, women better. We have to have those conversations,
Yeah,
Sam. It's very easy. And
yeah,
you know, like I remember having a chat with, look, I talk about my difficulties as a brown female doctor, but there are many IMGs, for example, that come to Australia and then they often feel even more marginalised. And then I remember one of these doctors saying, you know, how difficult it was. And what she suggested was, you know, have a coffee with an IMG and just sit down and ask them how you can help them. And it's just so simple, so simple. We have coffee all the time with our colleagues. Ask them how they're going, ask them about their challenges. If you're a consultant or if you're a junior trainee, ask someone if it, you can ask for advice, you can ask for support, you can ask for mentoring,
mm,
and often it helps to bridge those barriers, right? Conversation is where it starts, Sam.
mm, mm. I mean, I sort of chuckled the moment you gave your answer because here I am going, you know, how can you launch into solutions? But I was like, but you're so right. Start with understanding. Start with understanding better. And you know, how much of a better colleague could you be if you every month had a coffee with someone who was different from the people you normally have a coffee with? Ask them what was challenging them. Find out about their background. Just you know, how much could you move forward as a more sort of equitable and inclusive doctor? It's just, I think that's such a great idea.
Well, medicine teaches us to learn about our patients,
Yeah.
right? But we should also try and learn about each other and learn about ourselves. And I think for me, anyway, going through medical school and then when I listen to patients, different patients from different backgrounds, I learn from their stories. And so, same kind of thing, we can learn from each other and make the world or our spaces a better place for each other.
Absolutely, I love that, and it's so simple. It's such an easy place for anyone to start. That doesn't take any more time because we all stop and have coffee anyway. So it's such a great idea. What would be some advice you would give to anyone who is in that position and feeling marginalised for whatever reason?
So, first of all, don't be afraid to speak up.
Mm-hmm.
Look for a network, whether that's on Facebook. There's so many doctor groups out there that you can reach out, even as an anonymous member if you're having difficulty.
Mm-hmm.
And then try and build that support network is what I'd encourage, Sam. And I think something that a lot of us should do is we should have our own general practitioners looking
Mm-hmm.
after our care,
Mm-hmm.
so that we have someone outside of medicine if we
Mm-hmm.
are struggling with burnout or
Yep.
other challenges, physical or medical challenges, so that we're not just relying on ourselves to
Mm-hmm.
pick up those difficulties.
Yep.
So that's what I would say. Yeah, you need to have a support network, and you need to try and build that support network, and reach out to people. Reach out to people for assistance or help. I mean, like, I'm always happy to have DMs on my Instagram page if anyone needs any mentorship or assistance. So very happy for that. That's what I'd suggest, Sam, having
Mm.
that, and then go to like in Australia we have like the AMA, and I'm sure in New Zealand you have what's your similar version in New
We used to
Zealand?
have the NZMA, but it's no longer. So, yeah.
Oh, okay. So,
Yeah.
but there would be medical, like,
Yeah.
places where you can catch up,
Absolutely.
conferences that you can
Yes.
go to. So,
Absolutely. Yeah.
yeah, so go and listen to people talk at those conferences or those events. And then there are possibly other women in leadership or
Yeah, sure.
other doctors that you can, connect. Networking is important. So
Mm.
I think I find that really does help.
Mm.
Um, so that's what I would suggest. And then family, and speaking to your family and looking for
Mm.
support. Try not to feel alone. And then obviously if people are going through more challenging, there's lots of helplines available. You might have to check this doctor's
Mm.
helpline, I think is the one that we have here in
Yeah.
Australia.
And,
Yeah.
and do you find that there is an appetite for positive change? Do you find, like, we aren't, it's not 20 or 30 years ago, like people, and I guess, so say someone is behaving, a consultant is behaving in a way without thinking about it, that is being, is sexist, for example. Do you find people actually want to know that? Like, most people are trying to be better.
Yeah, 100%. I would say that the people, like, I can't even think of an incident. Like, my beautiful colleagues um, are so supportive in this area.
Yeah.
Even like for my own book launch, I had consultants coming from all different specialties that were
Mm.
very keen to hear about what I had to say, and some of these were consultants for me when I was a junior doctor,
Mm.
and they came and supported me at the event, and very happy to purchase the book and then spread the message that I'm trying to convey. So I think, yes, 100% we're moving in the right direction. There's so many great podcasts out there, like what you're doing as well. With this series. So there's a lot more awareness,
Mm.
and people are talking about these kinds of changes.
Mm.
People are open to it,
Yeah.
hence why I think these conversations are relevant.
Mm.
Um, yeah, definitely. And I mean, okay, we won't talk about the election.
I mean, yeah, probably a good idea. That to me is exciting, and that to me is hopeful as well for someone who's feeling marginalised, because I think so much of this is about awareness. And again, the fact that most consultants would be horrified if what they were doing was causing someone to feel marginalised. So they'd actually want to hear about it and change their behaviours. As I've found, talking to you, so many, unseen biases that I've maybe had, as soon as you shine the light on them, that's enough in and of itself to change them.
Mm, exactly. And the thing is, like, the reason, like, even with my book, people have layered identities.
Mm,
People often don't have one single lens as their identity.
mm,
So that's important to know so that we don't try and put people into a box.
absolutely. Absolutely. Well, that's where we started.
It's like
But
peeling an onion. You got to peel the onion
yeah,
slowly.
that's right. You're not one box, you're many layers.
Yeah.
And there's a full stop between each of them.
Correct. And I think, like, the other thing is, Sam, like, one of the things that I talk about in this book is that tug of war, that cultural identity, right?
Yep.
So for me, I grew up in Australia as a child of Sri Lankan background. And
Hmm.
throughout my life, I played that tug of war between the two cultures. Like, was I Sri Lankan? Was I Australian? And in the end, I realized that I'm both. And why is that relevant? I think for me, um, it's relevant because a lot of people share those struggles, and people who are of um, a person of color often do have higher rates of depression, anxiety,
Mm-hmm.
and things like that. And a lot of high school students struggle with that identity crisis of which one, and then again, having to constantly feel like you need to fit into a box. And so you and I talked about this concept of a third culture kid or cross culture kid, where you're kind of not necessarily one, but you're a combination of all of those things. And so these are terms that helped me understand my own, identity. And I think that's an important concept. Whilst this book I have written about my experiences in medicine, and being a woman in medicine, I've also highlighted the experiences of trying to play that tug of war
Mm,
throughout my life, because it does enter every single element of my life.
mm,
And so it's important. Like, I didn't realize until I went to America in 2021 how much I missed Australia, and that Australia, was my home,
right.
because of people, like, you're always trying to find places to belong, right?
Yeah, right.
But ultimately, like, where you belong is where you call home and where you have family. And so I think that's important, because a lot of people, I know this, a lot of people struggle with that sense of identity and that cultural clash that they're constantly having to juggle.
Mm, mm. I love the way I went and looked up cross culture kid, and I love the way that it gives it a very positive framework, because it's like there's massive benefits to being exposed to two or more cultures in your childhood. So it kind of reframes things as the positives that they are, doesn't it?
Yeah, 100%. 100%. I think so. So, yeah, it's important to sort of understand that
Yeah,
concept as well. And I think that's why it's so relevant for many people,
yeah,
because so many people have other cultural backgrounds. So
absolutely,
we need to celebrate this. This is where I'm heading.
absolutely.
Celebrate it,
That's
and
right.
don't be,
For ourselves, for individuals as well as as a group. That's the thing. Celebrating others as well as for those who are cross culture kids, celebrating themselves.
correct.
Yeah,
Yeah, exactly.
yeah, I love
Exactly.
that. Look, Sarah, the thing that struck me about this entire conversation when we were preparing and actually through today is how much of an opportunity this is for all of us to level up and to be part of the solution. We talked a little bit about introductions and things, and I think an important part that all of us can play is how we introduce each other. I don't introduce you as to the patient as hi, I'm Dr. Sam Hazledine and here's Sarah. This is Dr. Sarah Arachchi. We can all actually be part of the solution in terms of raising respect for each and every one of us in a collegial way. So I'll leave you with the final words. Dr. Sarah Arachchi, what final thought would you like to leave people with?
So I'd say don't give up on yourself. Reach out to colleagues for support, and know that you're not alone. Believe in yourself, and even when it's difficult, and know that what you do matters. What
Mm,
you do with your work and your life matters, and that sometimes we go through difficult experiences, but by sharing that with others, or from learning from each other, we can help to change the culture of medicine, so that it is more inclusive, diverse, and equitable for all of us, including our patients.
absolutely, and a diverse, equitable, inclusive medicine is what we all should aspire to. Thank you so much, Sarah. I really appreciate it. If you've been listening to this, which you obviously have by definition if you're hearing me talk, but as you're listening to this, I should say, if you want to know more about it, go out and buy Brown Female Doctor. It is a great book. Yeah,
Thank you.
so thank you so much for being on here and sharing your insights with us, Sarah. Appreciate
Thanks,
it.
Sam. Thank you.